All right, I'm rattling these off because they're coming to me. This is a series all about nursing assistants. First one I did was how it helps nursing students or people just thinking of entering the industry objectively learn the nuts and bolts of the industry, because you'll learn where the medications are, what is expected of nursing assistants, and most importantly, because nursing students is the majority of my viewers, what nurses are expected to do or they expect you to do as a nursing assistant, but what you as a nurse will expect from a nursing assistant. That actually helped me a little. Now as a nurse, I could see more, because I saw both sides. Now I say, oh my God, I was a horrible nursing assistant. I should have done this. And maybe I was just too blind and I was just still trying to absorb stuff in. I wasn't really a nursing assistant that long. I only was a nursing assistant for like a year and a half, and that was like part-time. So if you work that full-time, it's totally different. You pick up what I knew in 3 months. So objectively, I'm sorry for the background noises, my dogs. Objectively, they're going to teach you a lot. That subjectively is what my last video was about, is just the personality of every unit. You will be able to see it as a nursing assistant. You will taste the flavors, the personalities. Oh, so I don't want to work on this unit. I do want to work on this unit. I want to work with someone like that. I don't want to work with someone like that. All those aspects, because there are pain in the ass nurses. Let's just say it. They are guys and girls. There's male, female. It has nothing to do with anything, sexual orientation, race, or anything like that. If anything, I do see a lot of underlying racism. I see a lot of gender, the sexism both ways. So that's the subjective stuff that you see as a nurse and as a nursing assistant. I won't go into that. That's a whole long video on that. I'll get that some other day maybe. But it'll give you a flavor of what the units are as a nursing assistant. So objective, subjective. This video, I'm going to try to devote the last couple minutes of it to just how it can make you a better nurse. Those initial videos are just telling you, okay, laying down foundations and what you might want to do as a nurse. As a nurse, it will help you because you'll see what the nursing assistants actually do, how that helps your practice. Because what separates me from other nurses is how I treat the patients. Now that seems kind of like, what do you mean? Isn't every nurse doing that? No. Some nurses are just very objective. Some nurses are very reactionary, and that's a fault of mine. I'm not saying that's a strength of mine. I'm saying that's a weakness of mine. I need to build on those aspects. My strength comes from the interaction of the patients. I interact with patients probably better than any of the nurses that are left on the unit, but any of the nurses that I have there, because they don't have that social skill. And this is where my age comes into play and is my forte, my strength. And it's not a lifelong strength. I have been an introvert for 40 years of my life. Maybe 30 something years of my life. I've had to change that in the last 15 to 20 years because I was the salesman for my company. If I wanted sales, I had to overcome that introvert and go and grab that sale. And that has very much benefited me here in this industry, is that I am outgoing. Still have to force myself. I'm still an introvert, but I have to force myself. Like, this whole channel is part of that therapy, part of that addressing and going out and talking to strangers. I don't like that. I'd rather just sit in my room and watch the YouTube and put it on. So it is all of these things that help me interact with my patients. And as a nursing assistant, my background in that helped me get much closer to the patients and foster that and continue that. Nursing, it's what they say about doctors. Doctors, you only see the patient maybe 3 minutes of the day, if you're lucky. Okay? And how does that compare to us? And I always say, families first, they spent 30 years with the patient. Doctors are last because they maybe spent 3 minutes with the patient, ironically. Nurses were in between. We spent maybe up to 3 hours, maybe a little less, because you've got 4 to 6 patients on average. You got 12-hour shifts. How much time? Who spends more time? Ironically, in my experience with patients, even though they have more, they usually have anywhere between 8 to 10 patients. But that is much more intimate. Even though it's maybe an hour or 2 hours, and depending on if they have walkie-talkies, they might not spend much time with them, just looking on them. But you're in there. The techs are in the crevices of these patients. They get to feed them. They're interacting. Sometimes I feed patients, but 9 times out of 10, it's the tech. Who's bathing them? 9 times out of 10, it's the tech. I might assist because they need my muscle, but they're like, no. Especially my interaction with my techs, they value that I don't shy away from it. I pull up my sleeves and I go right into it, and I'll wipe first, and I want to look, and I'll do this dangerous stuff first because I know more. I don't want them to do something wrong that might expose them or the patient or something like that. So I said, no, and I teach them. So 9 times out of 10, they'll be like, okay, yeah, you could do it. 1 time out of 10 or whatever, the second time in, they're like, oh no, you showed me. I know what to do now. So being a nursing assistant helped me see how much time they actually use and save on my time as a nurse, and appreciate that. It makes me better and better to interact. Sometimes I'll ask the nursing assistants, what do you think about 4? What's this or what's that? What's your opinion? Tap their knowledge. They're not, nurses too many times think they're idiots, and they're not. A lot of these nursing assistants have decades of experience. Decades. Already. Some of them, even the old-time nurses, the 20, 30-year vets, they'll turn to them and ask. Why? Because they have so much more interaction with the patient than the nurses do. We don't have the time, because even though we have less patients, we're doing a lot more charting bullshit, interaction with the doctors, the procedures, the meds, all that crap. So, for nursing assistants, definitely it's a good avenue to take as a nursing student to learn that aspect of this. It's not the subjective side that I was talking about in my second video, but the actual, I guess, nuts and bolts interaction with the patient. And that's something that's very valuable and very lost on a lot of the new nurses I see. They are just deer in headlights. They have no idea because they're socially awkward sometimes. Seriously, maybe they've had a relationship, maybe they've had a lot of relationships. But even though they have a lot of relationships, how many successful relationships have they had? How many friends do they have? How many friends have they made? We as adults, most of my viewers are older, we're constantly interacting, whether it's soccer momming, it's baseball dadding, or vice versa, gender roles. You're interacting with other parents, other adults, whether in the bar or on the soccer field, or at PTA meetings, or at the supermarket, or at barbecues, or at business meetings, or whatever. So you're used to that. Putting a stamp on an envelope and mailing it is not even the thing for us, right? Not for the new generation. So in that aspect, being a nursing assistant helps you in not that regard per se, but you're more interacting with the patients, and that will hone your skill as a nurse to interact with the patients. And that's something that I find a lot of nurses these days do not have a good skill set. They just don't. The older nurses coming in, I find, are immediately, you could tell us that, they interact better. whether it's maturity, it's age, or they've been a nurse for a while. Then they eventually pick up on it, you know. So it's kind of like a quick in, you know. It's a shortcut. Okay. Good luck. I'm sorry for this longer video. Bye.